This segment of DelmarvaLife is sponsored by TidalHealth.
It cannot be overstated that the health and well-being of our children takes top priority. Finding the right kind of care that we can trust to be there for our children is just as important.
And as parents, we tend to have a lot of questions about ensuring our kids get the best care possible. And TidalHealth is committed to keeping that trust between child, parent, and doctor very strong. So with us this afternoon, this is Dr. Jason Coleman with TidalHealth Pediatrics. Thank you so much for joining us today.
Thank you for having me.
Let me ask you, we got a lot to talk about. What got you interested in pediatrics?
Oh, I don't know. I've always loved children.
Yeah?
They're fun. So lots of laughs, lots of smiles. It makes the day go by, and I just enjoy it.
It's a good day at work.
It is, yeah.
Ah.
What do you see as the most pressing healthcare challenges for young people?
Well, definitely mental health is big, at least where I came from, Central Virginia, and here as well. The support systems are lacking for mental health care for children. So a lot of that is falling onto the primary care managers who, whether you're a family practice physician or a pediatrician, you end up picking up the slack and trying to treat kids for anxiety and depression. So, and that tends to be the biggest.
So how do you establish and then maintain the open channels between the child and the parent and you?
I think it's really important to make sure that the parents understand that I'm a physician, but it's not my child. My job is to make recommendations. And if the parents like that, then we go with it, fine. If they don't, we look for other options. And sometimes they don't trust it, and that's okay. Yeah. The goal is to get them to know that I'm on their team and
You're
not on my team.
You got.
Yeah.
Yeah.
Can you tell us how you help families with their children and their selecting their health care?
Oh, yeah.
That's it.
So it involves lots of things. So one's obviously things that are easy, close by. So if they need a physical therapist or an occupational therapist, what's closest that can actually handle children? And then you work on things like, well, hey, is money an option, or is that a problem? So and then work to get them resources that they can use to establish care and get the other subspecialty care that they need.
Right.
So you can establish, get my words right here, a coordination between the specialists, between the healthcare people, the patient, the families. How do you do that?
So I like talking to the provider. So if I'm sending a child to the cardiologist, I want to talk to the cardiologist to find out what's going on and let them know what I'm sending them. So they're not having to read my note, which, as we all know, notes are kind of not so good.
You can explain much better in person. That makes sense. Yeah.
How do you coordinate the healthcare with the therapist, the specialist, everyone that's involved?
Well, so usually it's an initial evaluation. So I send them to whoever it is for the initial evaluation, and then they make recommendations. And then the parents and I talk about the recommendations. And obviously, if I'm not a cardiologist, so if they're saying we need to do this, chances are I'm going to be like, yeah, we probably need to do that.
Right.
But and this goes on with, again, are the parents comfortable with the subspecialist? And if not, well, okay, maybe we'll try someone else.
Right. So how quickly can you tell the parents you'll be able to get their child in?
It depends. It depends on the subspecialty. So pediatric neurology, you're looking much further out, so months. So 3-6 months easy. And some of them even longer, so it just depends.
So if you see something, act on it now. Don't wait.
Yes, absolutely.
Doesn't get better than that.
That's right.
Dr. Jason Coleman, thank you so much for talking to us this afternoon from TidalHealth. Wonderful to have you.
Thank you.